This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good evening, everybody. So it's a medical minute on a kind of straightforward little study that was done on one of the many things they've looked at to try and help with COVID. You know, I think we've all kind of heard there's not a whole lot we can do, especially for patients that are discharged. We tell everybody, you know, just kind of rest, take it easy, come back if you feel worse, come back if your breathing gets worse. But they've been looking at all sorts of different medications. And there was a recent trial that came out looking at the use of Budesonide, or an inhaled steroid, also known as Pourmand, is kind of the trade name for it, to see if that could help in outpatients who were at risk for getting worse. They looked at either people over 65 or people over the age of 50 with comorbidities, and they looked to see it whether it kind of made them get better quicker and whether it reduced need for hospitalization. And this was done in the UK, and it was kind of a cool trial where they were looking at a whole bunch of different things kind of concurrently, and if something worked, you know, they published it. If it didn't work, they stopped and moved on. And with the inhaled budesonide, they did find that it made people get better a little bit quicker, about 3 days quicker to recovery, and there was a decrease in need for hospitalization, but it wasn't statistically significant, but it did also seem to reduce that. So, you know, the nice thing is that it's something that's readily available. It's everywhere. You know, it's not hard to get someone a Pourmand inhaler. It's very safe. It's not expensive. So it is something, you know, that potentially we can do. You know, there haven't been many studies to prove that it's beneficial, but, you know, there's a lot of patients that we see that say, oh my gosh, you know, is there anything you can do? So sometimes, you know, giving something that is safe and maybe helpful can at least, you know, potentially help kind of make them feel like we're doing something, and hopefully it does help somewhat. So any questions, comments? All right, thanks guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.